Dr. George Meinig was one of 19 founding members and a long-standing president of the American Society of Endodontics. After reading the work of Dr. Weston Price, he realised the dangers of root canal therapy and wrote a book called The Root Canal Cover-Up.
Dr. Meinig defines root therapy as the story of how a caste of millions become entrenched inside the structure of teeth and end up causing the largest number of diseases ever traced to a single source.
Current dental schools, however, continue to claim that Dr. Price's research was based on a false concept, the theory of focal infection. A clear definition of focal infection was officially published by the American Dental Association in 1951.
A focus of infection is a circumscribed area infected with microorganisms which may or may not give rise to clinical manifestations. Focal infection is sepsis arising from a focus of infection that initiates a secondary infection in a nearby or distant tissue or organs.
The concept of focal infection in relation to systemic disease is firmly established. The origin of many toxic or metastatic diseases may be traced to primary local or focal areas of infection.
The headaches had completely stopped, and it took about two weeks for them to decrease, and then 2 weeks it kind of completely gone, and they haven't returned since. And
strangely, our current dental professors seem to be the only people on Earth who now claim that focal infection does not exist. The rest of the medical world is based on this principle. The clear statement of the American Dental Association from 1951 is now denied in their current 2005 position.
Root canal fillings are safe. The focal theory of infection does not apply as related to endodontically treated teeth.
The Australian Dental Association holds similar opinions.
The focal infection theory became severely criticised with well-controlled research, leading to the dismissal of this theory and a return to a more conservative approach to dentistry.
Medical literature is replete with references to focal infection. In August 2005, Medline, the largest source of published scientific medical studies, lists 1,248 entries for focal infection and 1,805 for focal infection dental.
Lifting the lid on this Pandora's box clearly demonstrates the spread of infection from teeth to the rest of the body, and the dental profession's arrogant dismissal of published scientific research. Spread of infection from a tooth may result in cases of debilitation or dehydration, exposure to radiation, diabetes, cancer, blood dyscrasius, malnutrition, vitamin deficiency, leukemia, multiple myeloma, and diseases of the liver or kidney. In 1996, the Journal of Dental Research published that focal infection should be a major concern in dentistry.